When you go to figure out where headaches come from, the best thing to do is examine and touch the fascia that holds your body together and see where it's tender. For example, you can grab hold of this muscle right here, a big thick muscle, about as big as your thumb. And if you run your hands over it, you can feel that there's ropes and cords in this muscle, surprisingly tender. Now, take your finger and go over the top of your collarbone, not the front, but push down on the top and run your finger along it. You'll feel little irregularities that might be also surprisingly tender. Well, this is the injury that causes this rope. And the first time you got that injury, you were an infant, and somebody picked you up by your shoulders, forgot to bring your head. Another time it happened, you were on the playground, 6 years old. Some little kid came up behind you, shoved you to the ground, snapped your head back, and tore where the strings and cords of fascia that go through this muscle and hold it together weave through the cover over this bone to anchor and hold you before they come down into your chest. Take your hand, get a big bite of your pec muscle, run your thumb across it, and feel the ropes and cords in there that are surprisingly tender. Well, you got that injury when you got up off the playground floor and pushed that little kid back. What's the significance? Well, take a look at this. This is one end of the injury. This is the other end of the injury because you're also tender in the back of your head. These are the kinks in those fascia cords and strings that go through this muscle. And this is the migraine and trigeminal neuralgia pain that comes from these injuries and these kinks. Again, let me remind you, your headache does not come from your head unless you're having a stroke or some other terrible thing. Headaches do not come from your head.